we have to hit record or it does that.
Good afternoon or morning, depending on where you are. Let's just give everyone a moment to join the Washington Days webinar, and we'll start in 1 minute. Hello, everyone, and welcome. I'm Marla Feinstein with NHF. This is your advanced webinar, so your 202 webinar. All attendees are in listen-only mode. Please use the Q&A panel at the bottom of the Zoom interface, and we'll answer all the questions at the end. I am joined by Nathan Schaefer and Joanna Gray, and let's get started with Nathan.
Great. So good afternoon, everyone, and thank you so much for joining. We're excited to have you, and we're excited to have new opportunities this year. This is a different webinar format. We decided to do one for people who are brand new to Washington Days or only have been once before. And we had that earlier today, and it was very successful. So our plan today is to have the information be a little more condensed because we know you all are veterans. And so we're going to be looking to you to help the new folks once they get to Washington and they prepare for success going up on the Hill. For those of you veterans that have done this a number of times, we really are going to look to you to help us in that regard. And the other thing we wanted to acknowledge is that there are new opportunities for new relationships. There are about 100 new members of Congress, and many of them, if not most of them, probably have not had significant interactions with bleeding disorder families. So we are excited to have interactions with new members of Congress so that they know who we are and what our issues are. But keep in mind that more so than in the past couple of years, we might be dealing with folks who are new. I mean both members of Congress, but also congressional staff as well. So today we're just going to talk briefly about what to expect and how you can prepare, and then I'll turn it over to Joanna, who's going to talk more about the issues that we've prioritized for this year. But we did just want to give you a brief rundown of what to expect. So as in years past, you'll arrive Wednesday morning, and we will have training that afternoon that will begin around 4:30. You'll have the materials that you'll get in advance that we'll cover today. You're also going to get probably next weekend in the final email with all details. But we will have all of the training together Wednesday evening that goes from 4:30 until 6:45, and then we will have dinner that evening. And you'll have time to get together with the folks on your team and prepare for what you'll do and what you'll share the next day. Thursday morning, we have, as usual, the legislative briefing, which will be at the hotel, and that will start at 8:30 in the morning. As in years past, we will have a member of Congress come and address the crowd and speak about the importance of sharing your story up on the Hill, and that's a new member of Congress who's actually from upstate New York. So Congressman Morelli will be joining us. And then you'll go up to the Hill, and as in years past, we will have a schedule prepared for you, and you just need to keep to that schedule. You'll have lunch on your own at one of the various cafeterias within the legislative office buildings. And once your meetings are done, you can make your way back to the hotel. And as in years past, we do have a post-appointment check-in where we'll want to hear about how your meetings went and what were some highlights and anything that we need to know. And that post-appointment check-in will be from 4 to 6 p.m. And then at 6:30, we will have a state advocacy recognition dinner. I promise you that the programming for that dinner will be brief and exciting. We know that by that portion of the event, folks are pretty tired. So we will have a brief program Thursday evening. And then Friday morning, as usual, we have the state advocacy training that'll take place between 8:30 a.m. and it will conclude at noon, if not sooner. And that state training is mandatory for all attendees. So please plan to wrap up with us on Friday morning. You know, what we tell everybody is keep in mind you're the only person that can really tell your story. And keep this in mind as you're recruiting other folks to come and participate at Washington Days. As you all know, you're not there to be an expert in health policy. You're not there to be an expert in the congressional process. You're there to be an expert on your story and what you want your elected officials to know about you and your family. As in years past, there are things that we encourage you to bring: bills, copies of an explanation of benefits, or a monthly or annual cost of what it's like to treat your bleeding disorders, photos maybe of a particularly difficult bleeding episode, or maybe when your child first learned to infuse. As you know, we encourage folks to bring photos. Photos say 1,000 words, and that can even be showing photos on your phone. Keep in mind that because of the time limitations of these visits, you won't be able to share many photos, but 2 or 3 can be really powerful. So think about that. And then, as in years past, we encourage you to bring vials of Factor, and that can be expired Factor or even a demonstration kit, and know exactly how much each of those vials costs, which is a very powerful way of communicating the complexity and how expensive it is to treat bleeding disorders.
Which is especially important with so many new members who are completely unaware as to what the condition means.
And we are in March now, so it is officially Bleeding Disorders Awareness Month, and we've had that designation now at the federal level at many states and even some local jurisdictions, so we're happy to maintain the momentum of that campaign. What we want you to know is we will have some ties available, but they're going to be prioritized for new folks. We actually have some limitations on how many ties we were able to order this year, and I know that we've been doing this for, this will be our 4th year. So if you have a red tie from last year or from a state advocacy event or any other event, or you have a red scarf or you made it your own in years past, please bring that with you. That'll really help us maintain the cost for Washington Day. So if you have a red tie already, please bring it along. And with that, I think we're going to turn it over to Joanna to talk about the 2019 issues.
Great. Thanks so much, Nathan and Marla. And thanks, everybody, for joining us this afternoon. We're so excited to have so many veterans, Washington Days veterans, at least, coming this year. And, to see so many familiar faces on our participant list here. I think a lot of what I'm going to cover pretty quickly will be familiar to you if you've come to Washington Days before. We'll definitely have time at the end for questions, and again, we'll go through all of this in more detail during the Wednesday evening training as well. Let's see if I can advance this. Okay, great. So our issues this year, we're focusing on 2 kind of big picture ideas. The first is because, again, we have so many new members of Congress and many new congressional staffers. We want to focus on educating them about bleeding disorders and the federal programs that benefit our community. And then on the kind of access to insurance side, we're going to talk about short-term insurance plans and how those are really inadequate for our patient community, and that we hope Congress will act to kind of prevent those from expanding, and I'll talk about that in more detail. But I think kind of even bigger picture than this, you know, during the 2018 election, basically everyone who was running for Congress from any party talked about how committed they were to protecting access to insurance for people with pre-existing conditions, and how much they cared about kind of health policy and ensuring that, you know, the patient community overall was taken care of. And so now I think we are well justified now, you know, several months later, to say, hey, Congress, you know, you Senator so-and-so or Congressman or Congresswoman so-and-so said that this was a priority issue for you. We're so glad to hear that, because it's a priority issue for us, and let's talk about how we can work together in the new Congress. We'll start with Bleeding Disorders 101, as we always do in our meetings. And those of you who've come before will know that we often encourage you to get through this in just a couple of minutes, so that we can then get into the meat of the policy stuff. But because we really are focusing on educating all of these new folks this year, we're going to encourage you to spend some time on this. Folks who are members of your team should talk about, you know, what their bleeding disorder is, how it affects their daily life, how they treat. This is where I think some of the visual aids that Nathan mentioned can be so helpful. You know, what is your daily life like? Do you go to your HTC? Where is your HTC? What happens when you go there? What really worries you? What keeps you up at night when you think about, you know, living with a bleeding disorder in 2019? I think this is just really important for educating these new folks about what it's like to have a bleeding disorder, not only so that they can be helpful to our community, but, you know, I think many of the issues that Congress is interested in tackling with respect to access to insurance and drug costs and, you know, other policies that benefit the patient community, we really are kind of at the center of all of those debates. And so I think we want members of Congress to see our community as a resource. The last thing I'll say on this is, again, there's going to be a lot of new faces, so would encourage you to be prepared to explain the basics. I often go to meetings and ask people if they're familiar with bleeding disorders, and they'll say, oh yeah, kinda. But, you know, I think, oh yeah, kinda isn't gonna cut it anymore, and so you should be prepared to say, oh, well, I'm so glad that you know a little bit about us. Let me go, you know, deeper, so that we can, you know, make sure that when you leave the room that people really have a good understanding of our community and what we care about. Speaking of things we care about, there are the federal hemophilia programs, and we have long advocated at Washington Days for funding for the CDC and HRSA programs. This year, we're also going to ask you to talk a little bit about NIH, and I know folks sometimes get caught up, concerned about, you know, which program was $5 million and which was $3 million and which one is 340B, and I don't want anybody to get bogged down in the details. It'll all be written out in your materials. So if you know, I'd encourage you to kind of stay high level about the need to support federal programs at CDC, HRSA, and NIH that benefit the community, and I'm going to talk through them in a little bit of detail now, but again, don't want anyone to feel nervous that you have to memorize all of this. You know, there are a handful of people who go deeper on federal funding issues in their meetings, and I think those people, I don't mean to be coy, but like if that's you, you know who you are, and my colleague Ellen and I are happy to chat with you more about where funding stuff is at the moment, but for most folks, again, I think we can stay pretty high level. So the first agency is the CDC, the Centers for Disease Control and Prevention, and they focus on surveillance at HTCs. This is the Community Counts program that you likely participate in when you visit your HTC each year. They also have funding for patient education and outreach programs at NHF. I think HFA gets some funding from CDC as well, so that funds programs like Steps for Living. Handy and NHF's kind of medical information resource had support from CDC for many years. And there's also work, those are two kind of examples where funding goes from CDC to other stakeholders. CDC does keep some of the money, and they have a lab and do research there at the agency. And they, you may remember, we've talked about this before, they developed a new test for inhibitors a few years ago, which didn't require patients to wash out. And I mention that just to say, you know, the CDC program started due to the HIV crisis, and I think it has been just so wonderful to work with our federal partners at CDC over the years. You know, while kind of blood safety remains a core component of what CDC and HTCs do together, the program has also evolved as challenges facing the community have evolved, and we want to make sure that all of that can continue. The second agency is HRSA, the Health Resources and Services Administration, and HRSA overall has grants and programs to improve healthcare for people who live in rural areas or who are economically or medically vulnerable. So in our case, they provide funding to HTCs to help cover some of the staff time for services that you can't bill insurance for, like the PT assessment, case management, and social workers. So much of what we think of as the integrated care that HTCs provide, you can't really bill insurance for, and the HRSA funding is important to helping to cover a part of that social worker's time or that nurse coordinator. HRSA also administers the 340B program, which is HTCs are able to participate in that program, which allows their pharmacy programs to generate program income that helps fund the services provided by the center. So HRSA, we care both about kind of the grants component as well as the 340B component. And then finally is the National Institutes of Health, which is our nation's kind of leading medical research agency. They fund biomedical research, you know, in tons and tons of disease areas. They're trying to make important discoveries to improve health, save lives, you know, develop cures for conditions, et cetera. What's exciting for us in our space, and you know, remember, hemophilia is a rare disorder. There aren't very many families who are affected in our country, and it's pretty exciting that there are so many federal agencies who are looking out for us. And I think in part, when it comes to NIH, that's because the director and the deputy director of the blood division in the National Heart, Lung, and Blood Institute are former HTC directors. So, you know, that we have folks who are high up at the NIH who are so familiar with the challenges facing our community, I think is in part of why these initiatives have been able to happen over the last few years. So last May, NIH held a meeting on the state of the science to develop a research agenda to prevent and eradicate inhibitors. They've also supported some genetic testing for the My Life, Our Future participants, and folks on the phone might have participated in that NHF project as well. The thing to know about supporting funding for NIH is that there is not a hemophilia line at the NIH. The NIH budget just works in a different way than other federal agencies. So all of the kind of advocacy groups don't support particular funding lines, but rather people agree to just an overall number for NIH funding that we will support. So, you know, if you get into the details of this in your meetings, the number that we'll have on the fact sheet is the same that basically every patient advocacy, you know, physician specialty group, research group, university, et cetera. Basically the whole kind of health community comes around a number, and so that's what we'll be supporting. And so overall, for the federal programs, the goal is we want Congress, you know, which has has supported us in these programs for a long time. We want that support to continue at CDC, HRSA, and NIH, because we know how important those programs are to ensuring access to specialized care at HTCs and kind of research and data collection that we need to kind of understand living with a bleeding disorder and developing treatment and prevention strategies. So access to HTCs, we know, is so important, and so is access to comprehensive health insurance. And before I kind of pivot to the details of what we're going to ask you to advocate on with respect to short-term plans, I thought it was useful just to have a slide defining the terms for the Affordable Care Act patient protections. I know lots of folks who are on today's webinar, have been advocating with NHF for a long time, and so you were there with us when we were pushing for all of these provisions to take effect back in 2009, 2010, when the ACA was under debate. But because these terms are thrown about so much, we just wanted to make sure that everybody was on the same page for what they mean. So when it comes to pre-existing conditions protections, it's really two things that plans are required to do, or not do, prohibited from doing, I suppose. One is that plans can't charge you more based on your health status. They can't set a premium based on having hemophilia or not, nor can they decline to offer you coverage if you have a bleeding disorder. The ban on lifetime and annual limits has to do with dollar limits on coverage, that before plans could institute, say, $1 million, $2 million. Once you had that much in claims, the plan would kick you off, whether that was per year or over the lifetime. Plans aren't allowed to institute dollar limits at all anymore. And that's because of what's called the essential health benefits, which are these 10 broad categories of services that plans have to cover. That's to ensure that coverage is comprehensive. Before, people would buy coverage that then wouldn't cover maternity care or wouldn't cover prescription drugs. Now plans are required to cover all that. And because lifetime and annual limits are only banned for services defined as the essential health benefits, making sure those 10 categories of services remain broad, that definition remains broad, is really important. So we know these protections were vital when they were included in the Affordable Care Act. And when Congress was interested in ACA repeal in 2017, these were the provisions that we were most worried about and what we advocated against to oppose so strongly. Congress was not able to repeal the ACA, but since then, in the last couple of years, the Trump administration has been able to use its discretion to provide states and plans more flexibility. In October 2017, President Trump signed an executive order, and that's what the picture is here, saying that he wanted the government to promote healthcare choice and competition. And the goal here is his kind of policy solution to high insurance premiums is that he wants to give people access to different types of plans that don't offer as comprehensive coverage so that they have lower premiums. The idea is more different types of plans means if they don't have to cover as much stuff, then they will be less expensive. And he sent this executive order that October trying to promote 3 different types of plans, and we're going to focus on the short-term ones during Washington days. So what are short-term plans? So short-term plans have been around a long time, but they were seen as kind of stopgap coverage for people between jobs or between other forms of coverage. And, as I think back, I think I bought a short-term plan back after I graduated from college, before I had my first job, because my student insurance ended. I couldn't stay on my parents' insurance because back then that wasn't, I was too old to be on my parents' insurance because the up to 26 policy wasn't in effect. And so to make sure I had something, I bought a short-term plan, which just lasted a few months, and then I had coverage through my first job, and then, I went on my way. But what the administration did last year is they changed the rules so that plans can last up to 12 months, and they can be renewed for up to 3 years. So what was kind of this gap coverage, kind of catastrophic coverage only, not super generous benefits that might get people between, plan A to plan B. Now these are plans that can last basically as long as regular plans, and they can even be sold on the ACA marketplaces. So it can be really challenging for someone to know whether they're buying a short-term plan or a regular ACA compliant plan. And the reason why you'd want to know is because, I don't know if it looks funny on your screen. I'm going to go back a slide and then forward. Okay, that looks better. The reason why you'd want to know is because short-term plans do not have to follow the ACA rules. So all the patient protections I talked about a minute ago, short-term plans don't have to follow. So they don't have to offer prescription drug coverage. In fact, about 3/4 of them don't. They don't have to have pre-existing conditions protection, so they can charge you more because of having a bleeding disorder, or can deny you coverage in the first place. They can have lifetime and annual caps, and they don't have to cap out-of-pocket expenses. So if you have a bleeding disorder, I would never want you to buy one of these plans because it's just not going to cover what you need. All of the patient protections are really important for us in particular, and these plans just don't have to follow those rules. So that's one way that they're really bad for us. But I think they're also bad because they weaken the overall individual insurance market because they are, I'll be honest, they're much cheaper in terms of the monthly premiums because they don't cover very much. And so if you are a younger or healthier consumer, you just want to buy the cheapest insurance you can, you very well may want to buy a short-term plan because of those reasons. And so if all of the people who can kind of afford to gamble with pretty skinny, meager insurance all move over to buy short-term plans, then the only people left in the regular individual market are people like us who need access to comprehensive coverage, which just means premiums are going to shoot through the roof for us. So it's kind of a 1-2 punch that makes the short-term plans, and it's really that they've been expanded to be competitors to ACA compliant plans is really kind of problematic for us. And so that's why we are supporting HR 1010, which was introduced by Congresswoman Kathy Castor. This is her picture here. And basically what the bill would do is it would basically rescind the rule that the administration released last year, which has expanded short-term plans. So on the House side, we're going to ask folks to co-sponsor the bill. There is not yet a companion bill in the Senate. There may be before you guys come to Washington. So, we'll have updated slides, of course, for Wednesday night. But our general ask is for the folks on the Senate side to support rescinding the rule as well. And again, I think there really is potential to draw bipartisan support for this idea because so many folks have now said they want to protect access to good insurance for folks with pre-existing conditions, and this doesn't do that for all the reasons I just mentioned. So then, of course, at the end of the meeting, we hope you'll thank them for their attention and willingness to hear about our concerns. We always encourage you to repeat the points again. So one, please support the federal programs that benefit our community. Please see us as a resource as you're working on policy issues in the new Congress. And please support stopping the short-term plan rule by either co-sponsoring the bill or just supporting that policy in the Senate. And with that, I will thank all of you for your attention, and I think we are ready to move to questions. And again, please enter any questions you have in the Q&A box or the chat box at the bottom of your screen.
I had one of the questions that came in was, what happens if someone on your team goes off script? What's the best way to handle that?
So the best way to handle that is to do what you can to rein them back in. As in years past, Washington Days participants are asked to sign a code of conduct, which does state that we have outlined the following priorities, and these are the reasons why we've prioritized these issues for this year. You know, what we said to folks earlier today is, you know, of course, this is an opportunity for you to make a connection with a congressional office, either with a member or their staff, and we want you to have that relationship to be mutually beneficial down the road. So if you want to follow up with someone that you've made a connection with about a different issue after Washington Days, that is your right as a constituent. But for the purposes of Washington Days, we need to stay focused on the issues. And we ask, especially for you veterans that know the drill, to encourage folks that might not have as much experience to do so.
And the next question that came in is about, can I bring, you know, childcare? Is there childcare? Sorry.
We definitely encourage folks to bring children because they can be very powerful storytellers. I was with a young boy from a southern state a few years ago who was in a wheelchair and had significant mobility limitations, which was actually very useful, even though he didn't contribute a lot because he's only 5 years old, in terms of what he said during the meetings, you know, that they could speak about his mobility challenges, communicated a lot about what it's like to live with a bleeding disorder. So you can bring kids, but we do not provide childcare. You are responsible for them during the duration of Washington Days, but you certainly can bring them. And we know kids can get a lot out of it. It's a very educational opportunity. But no, we do not provide childcare.
And I see one more, but I'm trying to get to it.
I think I can see Marla, if you're okay with me piping up.
Yeah, absolutely, absolutely.
So I think the question is, someone was interested in reviewing the House bill I mentioned before coming to DC. And so again, the number is HR 1010, and you can go to congress.gov is the website and search for it there, or if you want to shoot me an email, I can send it to you. It's a really short, it's only one paragraph. It's like my favorite kind of bill because it's really just one paragraph and says, basically, the rule entitled short-term limited duration insurance shall not have any effect, basically.
And I was just looking online, and to date there are 7 co-sponsors. So after Washington Days, I hope we'll see that number have a big spike. But that's not uncommon for a bill, especially this early into the Congress. So.
And we will definitely mark on your schedule if you're meeting with someone who's already co-sponsored the bill so that you can say thank you. So that'll be on your schedule.
And similarly, if you're meeting with someone on appropriations, you will also have that noted in your schedule, right?
Yep, you got it.
And if there are no other questions,
I think that concludes the webinar for today. This will be made available on our website in the next couple of days. So if you know anybody who was interested in the information but wasn't able to attend today, please encourage them to check it out. But we thank everybody for your time and attention, and we look forward to seeing you in Washington on March 27th.
thanks, everyone.
Thanks, everybody. See you soon.
Take care.